Health Minister Doctor Aaron Motsoaledi is today expected to announce the department's key strategies in the country's fight against TB. This is all happening at the Sandton Hotel, that's in the north of Johannesburg. The gathering comes ahead of World Tuberculosis Day, which is expected later this month, in fact, on the 24th of March. Watching developments is SABC News reporter Patricia, Visagie, who joins us now live from Sandton. And of course, TB, in some instances, known as a very silent killer in a country like ours. Patricia, this makes this particular gathering so important.
Well, good morning, Ayanda, and to our viewers. Of course, we're here at the End TB workshop that is taking place, where a lot of stakeholders, experts on this particular subject matter, the media in particular, that's been invited to this workshop. And this is to drive awareness, but also to create stronger partnerships in order to strengthen the fight against TB in the country, as it is one of the leading diseases that causes a lot of deaths in the country. Just before the COVID-19 pandemic, it was actually standing at #1, and then COVID took it over, but now it's back to the #1 position, and hence the drives to create more awareness, bring the media on board as well to play that active role of conscientizing society, but most importantly make sure that people do get tested and get on the right treatment. And there's that strong link between TB and HIV and AIDS. And to talk more about this, I'm joined by Dr. Thank you so much for joining us. When we look at perhaps the prevalence of TB in South Africa in particular, the link between HIV and AIDS and SANAC's role in terms of dealing with this.
Thank you so much. So SANAC is the highest decision-making body in terms of HIV, TB and STI policy in the country. We do find that TB is highly prevalent in people living with HIV, and more than 50% of people living with HIV actually have TB. So we have a high TB, HIV co-infection rate as a country. We have a high level of drug-resistant TB as well as multi-drug resistant TB. So we actually find that mortality is also quite high in people living with HIV that are actually dying from TB. 54% of mortality occurs in people living with HIV, and that number is 56,000 people dying every year from TB in our country. And it's not acceptable when you consider that TB is preventable and it's truly curable. And that 56,000, maybe it's a number that is difficult to understand, but if I break it down for you, it's about 6 people dying every hour from a curable disease, which is completely unacceptable.
And where is it going wrong? Why is society battling to protect themselves, one, against TB, but most importantly, get the treatment, and why are the statistics around it not going down as much as there is a lot of work around it?
There is a lot of HIV in South Africa. We are one of the countries that has got the highest absolute number of people living with HIV in the world, 7.8 million, which is estimated. And that means the amount of TB that we have linked to HIV is quite high. Now, the fact that there is stigma that goes along with that doesn't help the situation. People don't come forth because of stigma. People still think that TB is still only linked to HIV, but what we are starting to see now, especially with people getting access to antiretroviral therapy, is that we are seeing slightly less mortality and slightly new cases of TB, but we are seeing cases of TB in people that are not living with HIV. So if somebody just has a cough, or they're just losing weight, they don't take it seriously. So we are seeing very poor health-seeking behavior, especially amongst men, and especially amongst people who don't regard themselves as being prone to having TB. So that's why we are actually commemorating TB month. We are saying the media has got a wide reach in terms of raising awareness and making sure that they educate people that whether you are living with HIV or not, the amount of TB in this country is such that all of us are at risk and we all need to be tested.
Talking about a stigma, just like with HIV, there's often that misinformation that there is a class that is prone to TB, while it's very evident that actually does not discriminate.
It does not discriminate. It knows no race, it knows no color, it knows no border, and it knows no class. I think you were in the room when we saw the gentleman who is a TB survivor, a well-off young man who looks very, very healthy. So we need to understand that TB is so highly prevalent in this country that it is a disease more still of malnutrition. It's a disease of poverty. But when you consider that we've got 7.8 million people living with HIV, and it's no longer a disease that is just, it's no longer just a disease of poverty. It's a disease that affects you when you interact with other people. When you are interacting with other people and moving amongst people, just by breathing the same air, you are highly likely to catch TB.
Would it then be correct to say that perhaps everyone needs to test once in a while to see if they have it, as it has been mentioned inside by some of the experts, that sometimes there are no symptoms, but you're living with TB?
I think I mentioned when I did my opening that it's my call to action. Every single South African needs to be tested for TB, whether you are living with HIV or not. Families, index cases, so where your family member has got TB and you live in the same household, you need to get tested. But irrespective of your HIV status, irrespective of where you are, as long as you are living in South Africa, for the burden that we have, we need everybody to be tested for HIV today.
I heard earlier you were talking about, holding hands, all the different stakeholders that need to come on board and do their bit. You're appealing on the media to activate that educational drive in our communities. Maybe just share with us, what is it that you would like us as the media, as journalists, to really do quickly to drive that message? During COVID-19, the media was very active in driving the message, and it paid off. What can we do this time around to assist government?
I'd love for the media to really help us to educate people to be empowered that TB can be cured, and therefore there is no need for stigma, because TB is a disease that occurs commonly. It occurs commonly, but it is curable and it can be treated and it can be preventable. When we can see that you are most likely to get TB because you live with somebody that has TB, we are able to put you on TB preventive therapy. So if the media can put the message out there that this is a preventable disease, it's a curable disease, you don't have to die from TB, that would be so helpful to kill the myths around the stigma and the misinformation around the fact that TB is a death sentence. It's not.
I just want you to quickly summarize the program that is being rolled out here today. Its genesis, its objectives, and really the importance of having such a program. When you speak to many people, they'll tell you that often we see program after program that's being launched in South Africa, campaign after campaign, and many people wonder, do these campaigns really pay off?
They do pay off. I think when you look at the stats, I recommend that everybody looks at the brochure that was given out today and look at where we have come from in terms of TB and how it has been underfunded and how it hasn't been a disease that has received the focus like HIV has. HIV has essentially been a poster child, and TB has been ignored, and yet it has been a major killer in terms of infectious diseases. So this program became important in terms of ending TB as a public health threat by 2030. We saw that in our country, people were living from HIV but continued to die from TB, which was sad. And we decided to say, let's give the TB not only the attention that it deserves, the funding that it deserves, but also the resources in terms of the testing and upgrade to molecular testing, not just microscopy, where we used to just take a sputum and do a test that could take weeks to come back. You are now able to get your test results on the same day. So there has been an active effort to say the degree of mortality and morbidity that we see from TB is completely unacceptable, and the country is saying, let us then ask our journalist friends to help us to put the message out there to say, can every South African get tested for TB, and can they get access to treatment so that they can be cured? And if they are living with somebody that has got TB, can they get access to TB preventive therapy so that we can end TB as a public health threat by 2030?
All right, thank you so much. That is, of course, Dr. Timisile Ngulu. She is the CEO of SANAC. We'll also be engaging the Minister of Health, that is Doctor Aaron Motsoaledi, who's also inside, joining the many experts that are here today to obviously talk about this program that is the End TB campaign, aimed at, of course, making sure that at least every South African, even if it's once in a while, does make sure that they get tested for TB. You heard there, it does not discriminate, and often there are no symptoms, but you're living with this disease. It's back to studio.
Such an important story indeed. Patricia Visagie, live to us there from Sandton. Thanks very much indeed.